Nursing practice has changed drastically throughout the years. Through the countless nursing theories published containing new ideas, knowledge, and perspectives, it has led to the development of nursing as an academic discipline and as a respected profession.
There are already a ton of nursing theories available, which help in the global understanding of what nursing really is all about. These are developed by various nurses with different cultures and backgrounds, which influence their own understanding of the nursing practice, aside from, of course, their academic and clinical experiences. And one of these nursing theories is our very own Carmelita Divinagracia and her COMPOSURE behavior model.
Every individual may encounter various biobehavioral and physiological crises throughout their lifespan, which may have a negative impact on one's well-being. This is on top of the individual's psychosocial development, which progresses from infancy, adolescence, until adulthood, as presented by Erik Erikson's Psychosocial Development Theory. And as nurses, it is our responsibility to provide optimum care regardless of the person's age, race, creed, gender, social class, and nationality.
The psychosocial development of a person starts at infancy and is the most crucial stage of a person's life, but various medical conditions may arise as early as pregnancy. Thus, nursing intervention becomes a necessity from that point on.
Nursing an infant is very different from an older adult population simply because neonates cannot speak. Their language of complaint, of pain is totally different from the way adult population expresses. And so you need to be able to identify, pick up the subtle signs and symptoms for when they are trying to communicate that something is not right with me. As a member of a team and as a trainer, we recognize the importance of having the parent as part of the care team. When you have a good partnership with parents, you not only provide them tools to help them recognize what is going on with their sick neonates, but you also prepare them to care for the child, for the infant when they are ready to go home. Establishing rapport and relationship with parents is synonymous to having an additional army that would help the pathway of a child easier going home.
Families play a vital role in the psychosocial development of a child, especially in developing trust and mistrust as it is based on the dependability and quality of child caregivers.
It is indeed challenging to nurse infants since clearly they don't have the means to communicate verbally, making them heavily dependent on their parents. But that's no longer the case for adolescents seeking nursing intervention. The only similarity is that both stages requires the presence of their family.
You see, most of our clients are abandoned patients. Some of them are with no known information. So meaning to say, ang iba sa kanila are vagrants, so nakukuha lang along the streets, and even them doesn't know where they came from, they don't even know their name. We improve the infrastructure of the mental hospital so that the stigma will be removed. So hindi na nakakahiya or hindi na siya parang yung mga patients natin or yung mga clients natin at your age will have the freedom to talk. The term that we are using on that side is catharsis. It is a way of venting out their feelings, telling what they feel, which they cannot open up to their parents or to their siblings or to their relatives. Kasi yung iba, hindi sila nakaka-express sa kanilang mga mothers or father kasi kung nahihiya sila. But then because of that very good environment na suited for their situation, they will be able to come out kung magiging magaan sa kanila to express themselves.
But regardless of the different environmental and other personal factors, Divinagracia also focused on the importance of advanced nurses in providing nursing care.
Which begs us to ask the question, why advanced nurses?
So, ako bilang isang nurse ICU, is masasabi ko talagang mga case dun is critical. Yung iba semi-coma talaga, tapos may mga gunshot, head injury, tapos lahat sila may mga tracheostomy. Dito kasi isa sa mga nakikita kong barriers na patient to nurse relationship is yung communication talaga. Mostly sa mga matatanda talaga yung ang hirap makaintindi. So kahit paliwanagan mo sila, gusto nila ganito pa rin yung mangyari. Halimbawa, kasi mostly naman tatanungin para saan yung gamot na to. Ito, anong gagawin mo sa akin? So, if you're knowledgeable and if you know the basic fundamentals of nursing, lahat ng yun masasagot mo.
Carmelita Divinagracia's model allows the nurse to practice and develop therapeutic techniques to provide holistic care to patients, regardless of their psychosocial development deficit, through the nurse's competence, presence, open-mindedness, stimulation, understanding, respect, and empathy.
Nursing theories doesn't only provide foundational knowledge for future nurses, but it also gives us a glimpse of our history.
We believe that we learn from the past so we can better shape our future.
But who knows where nursing will go?
And as future nurses, we
We have the power to create a better future for our people. But for now, let us think of what we can do and who we can become as future Vincentia nurses.